So let's have a look in another one, okay? I think this one is a bit easy. We mentioned it before. We just go more quick to catch much cases, okay? What? Yeah? I think now, yeah. So you are thinking about, yeah, something related to Chiari type, whatever, yes, Chiari 2, with this criteria. Supratentorial brain present all with hydrocephalus. So one of the very, very important to check hydrocephalus. There is corpus callosum agenesis, yes. Corpus callosum dysgenesis, exactly, yes. And falcus cerebri, there is fenestration and sometimes herniation of the gyri, mass intermedia, okay, big tectum. So check for the criteria of Chiari. If you find encaphalocele, then it will be Chiari 3. If you don't find encaphalocele, so it is Chiari 2. Okay. Check the posterior fossa. Probably you will find one of this criteria. Chiari, all types of Chiari is very important in the exam. You will find if they put something in the congenital, sure that one of the important questions will be about Chiari. Okay. Let's check this one, and it is differential. Yeah. So you find appearance in CT with calcification. This calcification concerned with the gyri. So you have, yes, with this gyri calcification and probably this appearance, you are thinking about Sturge-Weber, one of the commonest angiomatosis in the exam. They like it. Sometimes it can come to you as a short question. And you can read, especially to have something like portoine nevus. This is along the division of the cranial nerve, 7 cranial nerve, 5 trigeminal, yes. Okay, and something in the skin. Okay. Another case that come in the pediatric age group, this, it can be like a differential. You will put one of the differential that happen in the gray matter, in the white matter. So you are thinking with white matter disease, it happened in the pediatric age group. So one of them will be this syndrome. Sure, that is not spotting or not antimony case. Just you need to put differential. So you need to put some differential of the white matter disease coming in the pediatric age group. Okay. Again, lesion in the, yes, the right frontal region, yeah. So with this appearance in the flare and the post contrast, yeah. So is it intraaxial or extraaxial? So if it is intraaxial, what it could be the differential? Oligodendroglioma, maybe, yes, but you don't have calcification. Yeah, here you have calcification, maybe, maybe not, but apparently that the patient make operation, but I mean another patient, but he make operation, yes. So what it could be, many appearance of this case, you should put differential, sure, this is one of the differential. Here, to be honest, very important to mention that this patient have type of herniation, which is subfalcine herniation, and you should comment on this because this is most important than to mention the differential. So this patient have midline shift. So this is the types of oligodendroglioma, with the most important that you think when you find this calcification. When you find calcification, put in the differential oligodendroglioma, but don't forget metastasis, don't forget other things that can cause this appearance, but yeah, sure that oligodendroglioma, one of the good differential. Okay. Slowly growing tumor and WHO maybe 2, I think. Okay. This patient has this appearance. I think you can see with me that there's something going here with apparently cystic or necrosis. This is post contrast, so you can mention that it is non-enhancing area here. So where is this appearance? This is the parotid gland, right? So this is in the muscle here. What could be this muscle? And what is this appearance? And if you look, you have in the X-ray something also. Yeah. So maybe related to infection, abscess, or collection, maybe. Any other suggestion? Yeah, so this is abscess. It happened in the masticator space, and yeah, the differential will be osteomyelitis. If there is any necrotic tumor or squamous cell carcinoma, maybe lymphoma, especially after treatment, other minor salivary gland tumors, and sarcomas. It can come to you in the masseter space, also rhabdomyosarcoma, especially if this patient is young. Yeah. So one of the good differential, yeah, rhabdomyosarcoma also, especially if this patient is young. Yes, rhabdomyosarcoma again, and you can put anything else. Okay. This is the nasopharyngeal space, the superficial mucosa space with the place of the nasopharyngeal tumor here, along the fossa of Rosenmuller. Yes. So you can see here that there is something going here, soft tissue mass, and very, very big, that you can consider it as malignant tumor. And one of the most common will be nasopharyngeal carcinoma, sure. And sometimes it can come to you in the exam with this appearance with mastoiditis, and it's very small, but you can see this small tumor after you check the mastoiditis. Okay, so the pharyngeal space, it can have this nasopharyngeal tumors. Okay, so what about this space? We mentioned it before. Is as a review for the this behavior. Okay, so what it could be? This is, yes, the carotid. Okay, this the carotid space. Yes, I can see that the internal jugular and the carotid here are displaced, but you can check here how they are, how they look. So one of the differential second branchial, but not the site of this. What do you think? Yeah, it appears that, yeah, going with something else like neurofibroma or carotid body tumor, or yes, I agree with you. And like this tumors can come in the carotid space, could be carotid body tumor. Yes. What about this space? We mentioned it before. Yeah. So what could be the differential you put? Yeah. You will put many differential, but don't forget something related to schwannoma, especially if it is enhancing and in the T2 high signal in T2. Okay. So one of the will be the schwannoma. Okay. Again, the parotid space, something necrotic, and it is high T2 signal. If you can see the CSF here, high signal, it look like CSF signal, so very high in T2. And here it have been like okay. So Wharton, one of the good differential, perfect. What could be else? Yes, here. Yeah, again, another case, similar. And extending through the deep loop of the parotid. So pleomorphic adenoma. So in parotid, we mentioned before that it doesn't give one diagnosis. You should put differential, because the parotid, you cannot know exactly what it could be until you take a biopsy or you remove it. So this is important. One of the very important spaces, the retropharyngeal space, which is here, and there is lymph node here can come, which is lymph node of Rouviere, right? And maybe there is pathology in the muscle, which is longus colli muscle here. So you should try to differentiate which could be. It could be the muscle, or come from the lymph node, or it can come from the nasopharynx. So you should put differential and check the case, and we can see that there is lymph node. So this is, sorry, Rouviere, yes, Rouviere. Suppurative lymph node of Rouviere, one of the commonest lymph node here that you should check it. The perivertebral space, which is very critical space, and we like it in the emergency. Yes. Sorry, here. So if you suspect that could be infection, so they tell you that this infection can extend up and down, even it can reach to the mediastinum. So you should be careful that even you can reach very low level or a very high level because you have open space until down, okay? So this is Diskitis with prevertebral abscess, okay? Diskitis with